Hello, everyone, and welcome to another episode of Random Health-ish. I am your host, Dr. Gloria Stone Osbeck, and tonight we have a very, very special guest. We have Miss CHARLETHA Isaac, and she is going to be talking to us about speech therapy, and we're going to be discussing the myths versus the reality of this profession. So please join me in welcoming Miss CHARLETHA.
Hi.
Hello. I just want to say thank you so much for joining us tonight. I'm so excited to have you. So let's start off by just telling us a little bit about who you are and what you do.
Okay, so I'm actually a native of Alabama, but right now I reside in Houston, Texas. I've been here since '04. But my career started first of all, I'm a alumni of Alabama A&M University, where I received my master's degree in communicative sciences and disorders. Which my ultimate goal was to practice speech language pathology. But prior to that, I studied at University of Alabama in Huntsville in the BSN program there. So I did practice nursing for a while, which kind of, led me to the career of speech language pathology. Um, in nursing, I primarily work with cardiac patients, but I had a desire to kind of specialize and work with individuals who had swallowing disorders and who were neurologically impaired. So that led me to the career of speech language pathology ultimately. So I've been practicing since 2001 and I love it. I work with adults all the way down to 18 month olds. So it's a very rewarding career and it does tie me to not only the medical field but the education field as well. So I love it.
Yeah, that's awesome. So what would you see an 18-month-old for?
Yeah, so even as early as 18 months old, sometimes kids they have noticeable language delays. We should be seeing things even before they are 12 months old in terms of cooing, having that vocal play with others. And if you're not seeing those type things, that's a red flag that you should seek help. You should start saying those first words, imitating environmental sounds, and if parents aren't seeing that, a lot of times their doctors will alert them, like, hey, let's get a screening or even an evaluation to make sure that, there isn't anything noticeably going on even at such a young age.
Oh, yeah, that's
And
so
because
true.
ultimately, the earlier, the better in terms of intervention. So it's so key to have a physician who's able to recognize that. And also parents being informed of those developmental milestones and what their kids should be doing at certain developmental stages.
Yes. And now a lot of people think, oh, for speech therapy, my child has to have a lisp or a stutter in order, for me to take my child to a speech therapist. What are some different conditions that you all work with?
Right. So we work with, of course, your articulation impairments where the kids are having difficulty pronouncing sounds. We also deal with apraxia, which is more of a motor programming issue where you're trying to say ball but you can't. You may say ball 5 different ways.
Mhm.
So not necessarily having difficulty with saying those sounds, but programming the speech process to get that word out correctly. We also deal with language impairments, which is it that encompasses a lot of things because you have expressive language, you have receptive language, ability to comprehend information, and you also have pragmatic language, which is the social communication. So sometimes kids who, especially who are on the spectrum, they may have difficulty with that. So we do work with that a whole lot, and even in sometimes up until they're in high school and even adulthood. So especially during this time, social communication is so important. And if you don't have those skills, you're lacking in the ability to maneuver, talk to others, even if it's an interview that you're having to do over Zoom.
Right.
So it's so important. In addition to that, we also work with fluency disorders. So, and that can include stuttering, cluttering, and we also deal with voice disorders. So, like for individuals who are, probably speaking too loud and they have some vocal abnormalities as a result, or even some kids are born with vocal abnormalities, we work with those issues as well.
Oh, wow. That's pretty awesome.
And then in terms of adulthood,
Yeah.
well, and even some kids, they may present with some type of neurological impairment, such as cerebral palsy and also stroke. So we definitely deal with those issues as well. But when dealing with a patient with stroke, we still may see some of that language abnormality and also apraxia and also some dysphagia as a result of the muscle weakness tied to having a neurological event.
Yeah. I remember when I was a residential assistant before I started chiropractic school, and one of the clients in the house, he had cerebral palsy, and so
Mm.
he couldn't speak, but he would use a keyboard, and he had this little headband, and he would kind of type what he want, and the computer would speak for him. And he didn't graduate high school, but he did go back to get his GED. And I was just so impressed. I just thought that was so awesome. You
Yeah,
know, a lot of people, when you see people with conditions like that, they automatically assume like, oh, something is wrong. They're not as educated, but they're regular human beings. So I just thought that was so amazing. I thought that was awesome.
it is. And augmented communication is so important, especially now because technology is, all kids are using technology. So if we can tap into that and help kids express themselves a little bit more effectively to others is such a crucial skill. People think in terms of communication, it's all verbal. It's not. We have nonverbal communication. And like I said, of course, we can have that assisted technology that can help us to communicate as well. So is very beneficial and really a hot topic right now.
Absolutely. So if a client wants to come to your practice, what can they expect on a first visit? Like, how would a first visit go?
Okay, for me, pre-COVID and even now, I initially start with the screening because I want to first hear what the parents' concerns are, and it'll give me a chance to put my eye on the child to see what their main concern is in terms of like if it's articulation, if it's a language delay, if they're having pragmatic issues, and then that'll help guide the evaluation process after that. And some kids, they just need some recommendations at home given to the parent. Or I'll start with that if it's a situation where the child is really young and the child hasn't been exposed to the things that I think they should be exposed to, such as that language bombarded in the home setting. I may
Mhm.
start there versus an evaluation. So that screening just kind of gives me a really good snapshot of where we should go from there.
Right. Absolutely. Um, so, what are some of the challenges you would say that you have faced as a Black woman jumping into the speech therapy field? I mean, you've been practicing for quite some time, so I can only imagine some of the challenges that you've had to face.
Well, fortunately, I did attend the HBCU and I had a really great experience there. I try to tell individuals who I mentor, like, don't rule out HBCUs in terms of the education that you can receive
Mm.
there and where it could lead you. So, and when I moved to Houston, I was welcomed and with open arms with the speech therapists here, and there's a very diverse population here. So I didn't really understand the grasp of how underrepresented we were
Yeah.
until probably a few years back when there was a lot of talk about the percentage of African Americans in our field. So like I say, here in Houston, I was welcomed with open arms and I thought that was the norm, and I just I moved around accordingly. I started a business here in Houston, and I've been in private practice for several years now. And I think the diversity here definitely helps and plays an important part in me feeling like I can really reach a lot of individuals without being held back. So,
Yes, my friend Angela keeps telling us we need to move to Houston. Like, you guys need to come on down.
Deal with the humidity is good.
Now, speech therapists can also help clients who have hearing loss as well. Can you tell us a little bit something about that?
Yes, there are therapists who specialize in working with individuals with cochlear implants,
Mm-hmm.
and that involves a lot of you know, teaching them how to hear sounds and teaching them which sounds they're hearing. And it's a very in-depth program that they go through to get to that point. So, and that's definitely a big thing here in Houston as well. There are certain practices, and that's all they focus on. And so
Mm-hmm.
it's very beneficial to those individuals with cochlear implants. They could go there and get that rehabilitation in order to get the most use out of that system. So,
Absolutely. What are some common misconceptions that you think people kind of assume when it comes to speech therapy?
right. I just think there's, as we were speaking earlier about not being aware of like the different areas that we touch in terms of providing services, and those areas can help your child socially in the school setting. Different therapists take different approaches, and I've worked in the school setting for many, many years. And even in my private practice, I still make sure the child is where they should be in terms of language development so they can be the most successful in school. So, kind of keeping all of that in consideration when you're working with a child, the speech therapist will do that. And even at the high school level, making sure that they're okay to go on those college interviews and speak appropriately and, respond to questions, to make those inferences when there's underlying messages when they're interacting with peers. All of that is important. And that's, a speech therapist can definitely help with that if individuals are lacking in those areas.
Yeah. So, would a person need a referral from their primary care physician, or could they just kind of reach out to you directly for services?
Yeah, so in terms of referrals, it kind of depends on the insurance or the method of pay. A lot of insurance companies, you just can call the therapist, but some plans you do have to go through your physician and get a referral in order to get an evaluation. If you can find a therapist that will do a screening first, I just think that's beneficial. And that's one reason why I do it, because it'll save the parents time if they do need to go to the doctor, in terms of knowing what to ask the doctor, to let the doctor know that the speech therapist is concerned about. So it just kind of depends on the insurance plan and the payer source at that point.
Yeah, that was going to be my next question. Is it something that is typically covered by medical health insurance?
A lot of the health plans do. Some health plans will only cover conditions if they are acquired. So if someone had a stroke, like something happened, versus if a child was born with something and it's developmental, some plans won't cover that. So, and then, the school systems, they do provide services free of charge. So that's definitely another method to get services if your insurance plan doesn't cover it.
Hmm. Yeah, that's very awesome. So, what are some of the challenges that you've had, like in terms of conditions that you have worked with that have seemed like really challenging for you to kind of help get them back on track?
Probably my favorite thing, even though it's challenging, is working with really young kids with phonological processing disorders and apraxia. But you may have a 2-year-old who's just not saying anything, like anything at all. And then by the time they're 4, they're talking off your head. So, I think the first time I went through that whole process and I saw the effectiveness of the strategies that the parent was doing at home and working with their child at home, and me, providing therapy on a regular basis, I saw the end result of that. And so I know it works, but it's challenging, but it works. And at the end of the day, the child is, ready to begin school, and he can be the best communicator he can be in at that time. So that's my favorite thing to work with, but it's tricky.
Were you like discouraged in the beginning, like, oh my God, are my strategies working? Like,
No, no, it wasn't. It can be a slow process, but you know, I have a 9-year-old. So the things that I preached for years, I practiced when I had her, and I saw how exhausting they were.
mm-hmm.
So now I tell parents like, look, I know what I'm asking you to do. I know it's not easy, because sometimes, you'll tell parents to do things, and if you haven't done them before, you don't really have an idea of how taxing it is. But I had to, do it myself, and I saw, but I also see the end result. And if you're working with kids, like I say, the earlier the better. Um, Exposing them to language, even if they're not talking, is so important. And sometimes if kids aren't speaking, and they're only using one or two words, we use only one or two words. Well, that's not the best practice, because they're going to keep using one or two words because that's what they're hearing. So it's really important, even if they're not using a lot of words, that they're still hearing the language as it should be.
Yes.
So that's just so important. So, over the 20 years, I just know that works. And it's so
Yeah.
important if parents can start that when the kids are young, exposing them to, books, even though if they just make it interactive. Don't pick a boring book. Pick something they're interested in, and make up your own story. You don't have to follow the words in the book. They can't read the words yet. Make it
Right.
entertaining. So that's just so important. You have to remember kids are kids, and you have to keep it fun. And I think that's something that we forget in our quest to, oh, let me do a flashcard. Let me do a flashcard. No, kids need to play.
Yeah.
Play is so important. So
Yeah. It also, enhances their imagination and other things like that. What
exactly.
are some red flags that parents or teachers can be looking for in their students and their children that kind of lets them know that, hey, this child may need to see a speech therapist?
Yeah, so definitely, if independent on the age, if they're not using a lot of words, um, there are just some common words that kids should be using at a very young age. Go, eat, stop, open, more. If they're not using those words, that's definitely a red flag. If they get to the point where they should be using multiple words and they're not, the sentence list is still just stuck at one word, that's definitely a red flag, because you want them to use more than just the nouns or name the things in. So if they're trying to get a cookie, if they're only saying cookie, that's definitely a red flag. But like I said, some of that can be making sure that you're modeling what they should be saying. So sometimes it can be corrected that way, but it's definitely something we need to be aware of in order to make sure that they're exposed to that language and they can use it, or they may need to see a speech therapist. And definitely, if they're not having joint reference to activity. So if you're sitting down with them and you're trying to, do a stack the block activity, and they're just totally doing their own thing,
Mm-hmm.
that's definitely a red flag. If you're not seeing a lot of eye contact, if you're doing that vocal play with them and they're not doing it back, that's, those are some other red flags. So just overall, if you're trying to interact with them and they're not giving it back, rule of thumb, that's not what you should be seeing in terms of, definitely from the parent child perspective.
Yes. Have you noticed a correlation between like a lip tie or a tongue tie in kids that typically have issues with their speech development?
Yes, usually that's it. Well, it should be called. Usually, we'll do an oral motor examination when we're evaluating kids, and to make sure that that tongue tie is not there. And if it is, we refer them to a doctor who could evaluate to see if it's severe enough where it needs to be clipped. And typically, they'll still need therapy after that to, learn how to use their articulators properly. But, we've seen pretty good success with that, if it's caught early.
Yes.
A lot of time babies, they notice it even as young, as newborns, and then they will consider whether to take care of it or not at that young age.
Yeah, I know as a chiropractor, when I'm adjusting babies, newborn babies, that's one of the first things that we look for is like lip ties, tongue ties. We check their normal reflexes, to make sure that, they're responding as they should. And then we encourage the mom to give the baby, tummy time so that, you can avoid sensory issues later on as the baby is developing as well. Yeah, so that's pretty awesome. Yeah. So, for kids that may be watching, they may be in high school, do you have any words of encouragement that could possibly make them more interested in the speech therapy field? Or do you have any words for them if they're trying to still figure out what to do when they go to college?
Yes, pick the field of speech language pathology. It's just there's so many different areas you could possibly work. Like you can work in schools, you can work in hospitals, nursing homes, clinics. You can start your own business. So if you want flexibility, definitely long term, it's a great profession. Normally you do have to get your bachelor's, which is a 4-year program, and then you have to apply for a master's program. So sometimes that can be a little difficult. I've had individuals like they've applied to 10 school, but they got into the 10th one. So just don't get discouraged in the process, and definitely keep your GPA up even while you're in undergrad, because that's so important. They really look at that in terms of application acceptance to grad school, and just being involved. I think outside of your studies and trying to learn more, find a mentor, try to shadow others, and have that experience that you can tie to your desire to want to go to grad school. I just think that's important.
Yes, absolutely. Well, do you have any closing remarks? I know we didn't really kind of touch bases over how kids are misdiagnosed or underdiagnosed.
I tell parents, even with the first speech therapist you go to, if you think there's something different, and if your doctor is not telling you that there's a problem, but your gut is telling you there is a problem, just reach out and still get that evaluation or get that screening, just to make sure. If you need to go to 2 or 3 speech therapists to do that, still do it. It'll be worth it in the long term, to make sure that the language development is occurring as it should, because it plays such a crucial part in development for the rest of our lives. The kids are going to struggle when they're in school. They're going to struggle with reading, even if they have something as simple as their articulation concerns. And so you don't want that. So the earlier, the better that is treated. So if your gut is telling you something is wrong, and just get help, but don't compare, your child to every child who's the exact same age. But, communicate with your kids and engage with them. Make sure you're exposing them to language. But if your gut is telling you something is not developing as it should, seek help.
Yes. And to add to that, I would also say if you don't know each milestone that the child should be at a certain age, you can always Google that, look that up, just to make sure that your child is, following the development that they should be at that particular age.
Exactly.
Yeah.
And
So,
asking a lot of WH questions. That's important. You'll see a lot
yes.
of when, what, when, where, why.
Yeah.
Yeah, so those things, if kids are able to answer those type of questions, those are things that they're going to use in their language when they're creating their own responses. So those questions are just so important to present to them. So if I understand, behind, and I'm able to use that in a sentence, that's going to make my sentence more meaningful when I'm trying to describe things. So ask WH questions, and you can
Yes.
do that throughout the day as you're engaged in everyday activities. It's nothing extra that you have to buy or purchase, but so crucial.
Yes, absolutely. Well, thank you so much for joining us tonight. I'm excited to have you here. I hope that you all got something from this video because she dropped a lot of great nuggets that you can take home or take to your teachers, and some things that you can do at home to work with your child to encourage their proper development. So make sure you guys tune in every Monday night, 7 p.m. Central Standard Time, right here on Facebook as well as YouTube. And we will see you guys next week. Good night.
Thank you.
You're welcome.